At the State House, legislators engaged with leading LGBTQ advocacy groups and health providers on the state of LGBTQIA healthcare. Prejudice, limited access, and other barriers drive stark disparities between queer and non-LGBTQ populations.
We know that many LGBTQIA+ older adults are still very fearful about how they are going to be treated both by care providers, aging service providers. They're also concerned about how they're going to be treated by their peers, by other older adults that they encounter at a senior center, at assisted living, at a nursing home. Because many of those people were raised with a lot of the bias and a lot of the negative impressions of LGBTQIA+ older adults.
When this community experiences discrimination, they are likely to avoid healthcare providers, postponing preventative care and medical treatment, and living under long-term stress increases these disparities.
Trans and gender diverse folks are now re-feeling the effects of discrimination, of stigma, and this fear of accessing medical care is real. And pulling away, either individually or as a community, pulling away from medical care really risks increasing those health disparities again, and isolating and doing all of the things that, hopefully welcoming, patient-centered, compassionate medical care can help do to support healthcare in general and well-being.
When there are healthcare inequities, it is extremely psychologically distressing, as well as causing physical harm to members of our society, in addition to the economic impacts of not providing people with the preventative care and the proper care that they need, which can lead to larger health consequences later on. Beyond that, if it's transgender people now, and if it's HIV positive people now, who's next? We need to think about the fact that everyone in our society is entitled to good health care.
The event underscored the need to educate providers on the unique needs of Boston's LGBTQ+ community, while reinforcing that all people deserve the same high-quality health care.
The more that we leave people behind, the more that we're creating a hostile community environment. And honestly, if we're just being blunt and brass tacks, it costs us more money to leave people behind and then to have to care for them once we've left them behind. So this is an opportunity to really invest in our communities and invest in the strength of our world going forward.